Calaveras County. As you can tell by the sign, the doctor is in. Dr. Randall Smart, how are you?
Hi, Mike. How are you doing today?
I'm doing well, except this time around, I think I've got hemorrhoids.
No.
Yeah.
No.
So what's going on?
Well, statistically, you probably do, because 40% of people have hemorrhoids.
Really?
Yes.
My goodness.
Well, statistically, you probably don't.
Yeah.
60% don't.
Yeah.
But yeah, many people do, Mike. And,
Okay.
And you kind of, most people don't really want to talk about hemorrhoids, but when you got them and they're a problem, then they'll talk about them.
Yeah.
Right.
Yeah.
And so they're very common. They're very treatable. And I thought it would be a topic that would be really interesting for the audience.
Sure. Well, and helpful too,
Yes.
because like you say, we don't want to talk about them when we don't have them. And by the time we have them, we just want them to go away.
Yes, like on that day. you want
Yeah,
them to go
yeah.
away. Right,
In
right.
10 minutes, are we going to be good? So what's going on when hemorrhoids are happening?
So the hemorrhoids are actually veins. And then what happens is in the rectum, you have a whole plexus of veins that come down and kind of create a web of veins, and those are called the hemorrhoidal veins. And so those veins kind of terminate in that area, and they're really susceptible to pressure, and they can swell. And when they swell, that becomes what you would think of as a hemorrhoid. It's a big swollen vein.
Oh, okay.
And so that's what hemorrhoids are. There are two different kinds. There are internal hemorrhoids, which most people don't know about
Okay.
because they're internal. And there are external, which most people do know about because they can feel them or they cause a different set of problems. But there's two different kinds. They're very common. They're treated differently. And not all of them have to be treated. I mean, 50% of people with hemorrhoids have no symptoms at all.
Oh, really?
Yeah, they don't know they have them, they don't feel them, doesn't bother them. And if that's the case, you don't need to do anything. Nobody needs to check them.
Sure.
You don't need to, you just leave them alone and you're fine. But the other 50-60% do have problems, and those are the ones that'll be interested in hearing more about this.
Okay. So where do we start to draw the line over I need to contact my medical professional when I've got... Actually, maybe the question is, what are we feeling when we start to get these hemorrhoids?
How would you know?
How are we going to... Yeah.
Well, first of all, I guess from the doctor perspective, there are people more likely to get them and people that are very unlikely to get them. So the people that are unlikely to get them are people under 20.
Okay.
Or people that are really active. The people that are more likely to get them are the people between, let's say, 40 and 60 years old. People who sit a lot. People who are constipated.
Okay.
People who strain a lot. People who spend a lot of time in the bathroom.
Okay.
And so those are the people most likely to get them. And then when they do become symptomatic, there are a number of different ways you would know that. Probably the most common is bleeding.
Oh, okay.
And so that would be sort of blood in the toilet kind of thing. And what typically happens, the most common hemorrhoids are the internal ones.
Oh.
Now, the internal ones you can't feel. I mean, you could stick it with a poker and you wouldn't feel it.
Okay.
The external ones are extremely sensitive, and you could just barely touch it, and that hurts.
Okay.
So with these internal hemorrhoids, if they're bleeding, the only thing you may see is blood. And so you have a bowel movement, and typically what happens is when the stool comes out, there's a little coating of blood on it, and then you might even have a little bit of dripping. Not to be too graphic, but you might have a little bit of dripping, and the theory is half of us look and half of us don't. Now, I'm a looker, I'm a science guy, and I'm a looker, and So we should all be lookers, but
Yeah,
anyway, for the half that are, you see blood in the toilet and you go, oh my gosh, something's wrong, you know. And what's interesting is a little bit of blood can look like a lot.
Oh,
So
okay.
so if you took, say, a thimble of blood, a couple cc's of blood, and you dumped it into a toilet bowl, man, it would look like there's blood everywhere.
Oh, yeah, okay.
It's actually not a blood. Now, you can bleed a lot.
Yeah.
But the most common symptom is bleeding. It's painless bleeding, and it kind of comes and goes. It's usually with bowel movements, not at other times.
Okay.
And then there are other symptoms. One of the more common ones is itching.
Oh,
You know?
Okay.
And itching anything is really annoying. You know, your arm, your head.
yeah.
Itching your rear end
There.
is super annoying.
Yeah.
Right. So it kind of becomes irritated and it becomes itchy, and that's exactly what some patients will come in and say. You know, I feel awkward about this, but I have a lot of itching, and
Yeah.
what do you think is wrong? And that can be a sign of hemorrhoids.
Okay.
And we could talk about that a little bit. There are some unique things about that. And then pain can actually be a symptom. Now, the pain isn't with the internal hemorrhoids, it's with the external
The external.
that you might be aware of, you might be able to feel or be aware of.
Is that because the skin gets so irritated because the vessels have gotten swollen and
Well, sort of. Sort
Okay.
of. So the internal ones you can't feel because it's inside the rectum and there are no sensory nerves inside the rectum.
oh, okay.
So we could go inside a rectum and do biopsies, pinch off pieces of tissue, and you would sit there and say, I don't feel anything. It doesn't
Okay.
bother me at all. No Novocaine, no lidocaine.
Okay.
But once you go past a certain point anatomically, it's very sensitive. It's like skin.
Lots of nerves.
So yes. So the external ones are very sensitive
Okay.
and are treated a little bit differently. The external ones tend to clot, and
Oh.
that's called thrombosis.
Okay.
And people that have had hemorrhoidal thrombosis will remember it for the rest of their life.
Okay.
Right. Hurts. It usually has to be lanced and removed,
Okay.
which also hurts. But right, bleeding is the most common, then itching, and then followed by pain. And those are really the symptoms that would be related.
What separates an itch from pain? I'm feeling like that's a dumb question, but then again, I mean, when something, a mosquito bite itches on your arm, you
It's
scratch
like that.
it, and
It's
it,
like that.
and it doesn't necessarily go away, and then you stop thinking it's itching, and it's like, okay, now that's kind of aching. Is that kind of what's going on?
Well, itching and pain are two different sensations. Sometimes there's overlap with some of the diseases we see, but like a mosquito bite that itches, that's what a hemorrhoidal itching is like. It's not like a
Okay.
pain, it's like an itching.
Yeah, okay.
And one of the problems we see is people are aware of the itching, and so they become kind of very, very clean and really over-focused on hygiene, and I can understand that. I absolutely. So they become what you would call a scrubber. They scrub and clean and scrub and
Yeah.
clean to stop the itching. Well, the problem
That'll
is
make it worse.
it does.
Yeah.
Yes, that makes it very irritated and it makes it worse. So one of the things we look for when we examine these patients are they a scrubber, and is it like just incredibly clean? Because if it is, they need to stop scrubbing, and there's a better way to do it.
Yeah,
Right.
okay.
Yeah.
I guess since we've separated the two, what's the treatment for the internal hemorrhoids? I mean, how do you know that you've got them, that you're going to need to get them treated? Do they get to a point where they suddenly become painful, or?
No, they just bleed. In fact, I'll tell you a very interesting story. I had a patient, I'll never forget this. His name is Malcolm. He's not in Calaveras County, so there's no issues here. But Malcolm was from England. And Malcolm took a pillow everywhere he went. And I kind of started watching Malcolm because we go to the same meetings and the same events. I said, man, what is up with this pillow? And he says, well, every time I sit in a chair, I leave a red spot. So I bring the pillow so I don't leave the chair red.
Oh my
And I use the
gosh.
pillow and I said, "You've got to be kidding me." I
Oh
said,
my
"How long have you
goodness.
been doing this?" And he said, "Oh, years."
Oh my
I
gosh.
said, "I think I can help you."
Yeah.
So that bleeding can go on and on and
Okay.
on. Now, there definitely are treatments, and there's some very easy treatments, and that's one of the reasons I wanted to bring up this topic, is there's things you can do at home to treat this and get better.
Okay.
And so some of it is behavioral. So don't be a real scrubber wiper. Just common sense.
Yeah.
Do what the rest of us do, I think. But two is not to spend lots of time in the bathroom.
Okay.
So the people that tend to have more problems are the people that sit there and and strain and sit there. And so to try to stop that. I mean, sometimes it's hard because of work and other issues, but really try not to be, they actually call it a lingerer. Try not to be a lingerer. But then beyond that, there's very good evidence that if you add fiber to your diet, these get better.
Oh, okay.
And so we recommend people add what's called insoluble fiber. An example of that would be Metamucil.
Yeah.
And you could add a teaspoon of that a day, or maybe even twice a day, to where you're having really soft stools, easy stools, not a lot of constipation, not a lot of straining. That alone makes a big difference.
The fiber kind of does the scrubbing for you?
Not exactly. No, but it all goes back to the straining and the constipation, and so getting on that high fiber diet can make a big difference. They've actually done experiments where they just said drink more water, and in the experiments where they drank more water, those patients did better.
Oh goodness.
So,
Okay.
so there's some very easy things you can do. Now, I don't want to mislead the audience here. Sometimes these aren't hemorrhoids. Sometimes it's something more serious. And if you look at a medical book about anorectal disease, I can think 20, 30 things that can seem like a hemorrhoid. For the most part, if you're under 40, a little bit of bleeding, painless, and you think you understand why, that's probably all you need to do. But as you get older, you may want to make an appointment. You may want to make sure that's what that is. Sometimes you can feel things that you think is an external hemorrhoid. It could be something else. And so a note of caution here, as you get older, and certainly if there's any uncertainty, you would want you would want your doctor to examine you and make sure that's what it is. Now, that doesn't mean you bought yourself a colonoscopy or some major intervention. A lot of times we can do this work just by examining you in the office, taking a look and saying, okay, we know what it is, and this is what you need to do.
Okay. Now, the external hemorrhoids, I'm guessing, are the ones that are treated with the creams that are available in drugstores, or do those help the internal also?
They can help both.
Okay.
They can help both.
So primarily because they deal with the swelling?
Correct.
Okay.
Yeah, correct. And the Europeans, kind of interesting, I just thought this was, the Europeans are much better at treating hemorrhoids than we are. Maybe they have more of them, or maybe we're fortunate, or I don't know. Let's not go there. So the Europeans have better creams and better medicines. And they have for a long time. They're also over the counter, but just simple things like Preparation H is very effective and can help both internal and external. Now, if it's a thrombosed or a clotted external hemorrhoid, you're gonna need some help.
You're gonna need some help,
right?
Yeah. And you mentioned having to lance it and/or remove it. Does that then come with like lidocaine, novocaine, something like that?
It does. It doesn't work all that well.
Okay.
But of course you would do that. I mean,
it's one of those that you've just got to kind of deal
We
with
give
on
them
an
a stick to
individual
bite on,
basis.
and we go, okay, this will only take a minute. Right. No, of course, we use lidocaine cream and Novocaine, but it's still uncomfortable. I mean, absolutely. But it's very treatable. Now, the other thing is, let's say you've had the bleeding and you have an internal hemorrhoid, and you've done the fiber and you've done the water and it's still bleeding. There are medical things that can be done.
Okay.
And so there is something called it's called banding, and you can do hemorrhoidal banding. And hemorrhoidal it's like a teeny tiny rubber band. And so what you do is you take a scope and you kind of find the hemorrhoid and you slip the rubber band over the neck of the hemorrhoid.
Oh.
And about 3 days later, it falls off and goes down the drain.
Okay.
So that's a relatively easy procedure to do. There are people in Calaveras that do that. So banding can be done. You can also have surgery. I mean, there are general surgeons, and those are also in Calaveras, that sometimes the banding isn't the right thing, and so the surgery can be done. But there's a number of different treatments.
The banding, and I'm sorry I missed, is that predominantly for the internal or external or both?
No, it's for the painless, for the internal.
For the internal,
If
okay.
you banded an external, there'd be a fist fight.
There'd be,
Right, yeah.
okay.
You'd have to run to the parking lot.
Okay. Now, I guess where my brain is kind of stuck is, how do we know that internal hemorrhoid is so serious that it needs to be banded? Is it because we're bleeding for a period of time
Usually the
after
bleeding
we
might.
go, or is it the bleeding every time that we go?
Yeah, so I think people can use judgment, and if they have a little bleeding a couple times a year, that's probably not worth doing anything about other than,
Keeping an eye out for the next few
home
days.
Things, right. But if it's really interfering with your quality of life, then you should get the banding. Now, the other thing is there are definitely people that get anxious when they see blood. Absolutely. And so we have patients that if they see the blood in the toilet, it causes a lot of anxiety and sleeplessness and worry. And so maybe that's only twice a year, but because of that, we would probably do the banding because it affects their quality of life.
Okay. And the external that we're probably going to deal with the preparation H, how long have you got them before, okay, these aren't going away, I need to call the doctor? Or do they just kind of go away on their own?
They usually shrivel up.
Okay.
So they shrivel up and become more like a raisin.
Okay.
So they start out like a grape, and they end up like a small raisin.
Okay.
And if they shrivel up and end up like a small raisin, and you're pretty comfortable, that's all you really need to do. Now, one of the things that can happen is the internal ones can come out.
Oh, okay.
So they can be big enough that they prolapse out into the world, kind of thing. And that can be a real problem because for a lot of reasons. I mean, those tend to bleed more. You tend to be able to feel them more. So that's called a stage 3 hemorrhoid. And if you have a stage 3 hemorrhoid, somebody probably ought to do something to help you out. You probably ought to do something about it.
Then it seems like in medicine we always get to a stage 4. Is there that nightmare
There is a stage 4. There is it's true. Everything we do is stage 1 through 4.
Yep.
Right. So stage 4 is when, stage 3 is when they come out and you can actually push them back in.
Oh, okay.
Called reducing. You can reduce the hemorrhoid back and you can push it back in and get on with life. Stage 4 is when it doesn't go back in.
Okay.
You can't get it back in.
Okay.
And
by the time you've got stage 3, you're going to see your doctor anyway, it sounds like to me.
oh yeah, most people do, but I don't know, Mike. I mean, people, particularly in Calaveras County, people are tough, and they only go in when they absolutely need to go in.
That's true.
So I would imagine there's a lot of patients in our audience that may think, maybe I should have something done about this. The treatments are not complex and they're not disabling, of course, done in the right hands. So somebody shouldn't be denied treatment or think they have to run around the rest of their life with a pillow, so they don't turn the chair red every time.
Well, we joked a little bit before we started filming, but the little round pillow, is that hemorrhoids? The little rings? Are people who are sometimes using those, are they having hemorrhoids, or are they maybe having something else going on? And
The rings.
they're little blow-up rings that I've seen
that they
some
sit
people.
on? No, that's not a hemorrhoidal
That's something
treatment.
else. Okay.
That is usually related to, your tailbone, your coccyx. That can become inflamed, and that's called coccydynia. And it can be excruciatingly painful.
Okay.
And so if you sit on that, it hurts. This is one of the reasons. So you put a round cushion and you sit on that and it doesn't hurt anymore. Now the other reason is that you can have skin breakdown. Let's say you sit too long and maybe you're elderly.
Okay.
And you develop what we call decubitus ulcers, and these are areas of skin breakdown that are really susceptible to infection and problems. And we see those a lot, and sometimes we'll put those patients on what we call a donut.
Okay.
To promote the healing.
Promote the healing.
To get them to heal, right.
Where are we going with that external hemorrhoid that doesn't seem to go away? That's the call the doctor.
It can be removed.
It can. Okay.
It can be removed.
Same way.
And again, it doesn't require a university. It doesn't require a trip out of the county. It can be removed. Now there are surgeons called colorectal surgeons, and if you were to go to the very best person for that problem, it would be a colorectal surgeon. Now, the nearest colorectal surgeon is in Stockton. We don't have any in the Tri-County area that I'm aware of. But usually a good general surgeon can get through this.
Can do it.
And be very helpful.
Okay. Are hemorrhoids more common in men or women, or is it kind of across the board?
They're gender neutral.
Okay.
Women and men are equally affected. Now, there's kind of one caveat to that, Mike, and that is pregnancy seems to be really associated with hemorrhoids, and we think that has to do with the pressure in the pelvis and those veins being kind of pushed into a tight space.
Always under that pressure.
Yeah, and so the patients who have been pregnant tend to have hemorrhoids. Probably not 100%, but probably pretty high percentage.
And do they end up more with the external or the internal? Or again, is that...
More with the internal.
Okay.
More with the internal. The other people that tend to get a lot of these are the people that sit a lot, not just in the bathroom, but when I was in the military, the tank drivers used to really have problems with hemorrhoids. And then when I got out, it became the truck drivers. And the truck drivers, I mean, they sit in the cab all day long. And so they have a problem with these. So there are some subpopulations, but they tend to be gender neutral. Tends not to be younger people, tends to be middle-aged people, and really doesn't develop later in life. You don't see a lot of this in 80 or 90-year-olds.
Really?
It's kind of a midlife kind of thing.
Okay.
Which means you probably have them.
Or will. Darn it. Is it pretty much that just about everybody is going to get them at some point during their life? Or is that 40% a chunk of the population and that other 60%? I guess what I'm asking is, are we going to rotate into that 40% through the course of our lives?
Maybe. I don't actually know that, Mike, but I would guess a large proportion of our patients will have these sometime in their life, and most of those will not ever know they do have them unless somehow they're examined. I know for 15 years in this county I did colorectal endoscopy, and mainly in terms of cancer prevention, colon cancer prevention. But I would bet you, gosh, 90% of those patients had some hemorrhoidal changes.
Oh.
And most of them, they didn't know it. Mm-hmm. And we didn't even talk about it a lot. I would just, during the examination, I'd say, there's a small little hemorrhoid on the inside. And but it was very common.
Okay. Now we're down to about our last 3 or 4 minutes. I want to change the subject a little bit and just ask if there's anything brewing with the healthcare district and kind of how stuff is moving forward now that Measure A was approved. And
well, great, thank you. We're very excited about the work we're doing. We are still at the final stages of leasing the Mark Twain Hospital to Dignity Health. Mm-hmm. Those discussions, we had to, after the voters approved, we had to get from a 4-page term sheet to an 80-page lease.
I was going to say a multi-page.
Yeah, and so those discussions have been, I wouldn't say fun, but they've been so much. They've been so productive.
That's great.
And so we sit down with the Dignity Health leadership and we kind of tweak a few things here and tweak a few things there. And so this hospital lease is not far away, hopefully by the end of September.
Oh, great.
It's not far away. We're excited about that. We're next week, we are going to close a loan with the federal government that is $7.4 million that we're going to build a clinic in Valley Springs.
Oh, great.
That clinic is going to be in alignment with all the Mark Twain activities. So so it'll look like, feel like, smell like a Mark Twain clinic. I mean, it'll be new, but it's going to be sort of an integrated delivery system, and we're so excited about that. We think we'll open those doors in next June. We are having September 22nd, we're having a grand opening for a fall prevention program called Stay Vertical with Calaveras.
Yeah, we talked about that a few episodes ago.
So Mr. Steve Schetzline is heading that up for us, and that'll be at the Murphy Senior Center September 22nd at 10 or 10:30.
Okay.
But we're very excited about that. We're still doing healthcare grants, so we're having a lot of fun.
Moving right along.
And we think we're doing what the voters elected us to do.
Good. That's good to hear, Dr. Smart. Well, as Dr. Smart told us, add that fiber to our diet again. Every episode we do, it's about how we eat. So garbage in, garbage out, folks. So put in the good stuff. And, well, I guess in this episode, it's appropriate to say the good stuff will come out.
We could say that.
Yes. And just keep an eye out when you're going. Until next time, I'm Mike Taylor. Until then, the doctor's out.